I am Katy Wynne. I am the Cessation manager, as Ashley said. I've been at the South Carolina Department of Public Health for 26 years. This is my 26th year, but I've got like 40 years in state government. However, they just recognized somebody at DPH with 50 years of service. I'm not going to be around that long, okay? I have nothing to disclose regarding this presentation. So what I want to do for our objectives this morning is to present a brief history of the South Carolina Tobacco Quitline, to highlight the Quitline services and successes over the past 20 years, and forecast a little bit, I'm not the best forecaster, but what the future holds for the Quitline and nicotine cessation across the state. So y'all, I'm a real believer in, excuse me, if we forget our past, we can't fully appreciate our present or successfully forge our future. So that's kind of the premise that I'm placing all this on. So I want to talk about, okay, Sharon, you're going to laugh, okay? She went back 30 years. I'm going back 50 years, okay? Almost 50 years. So do you remember, and some of you, this will be new, y'all, back in 1977, I know it's before a lot of you were born, so I just don't care, okay? I'm not going to... Anyway, our cigarette tax was then 6 cents and rose to 7 cents per pack. Woohoo! We were the last in the nation, as Sharon's already said. And as Sharon's indicated, that same year, the national adult smoking rate was 36%, and today's adult smoking rate is right around 9.9%. Rajiv, if I'm wrong, y'all can just correct me, okay? And then, some of you know this. I know you're going to know it. Diane, I know you were there. I think Martha was there. I know Sharon was. Back in 1990, the predecessors of where we are today was something called the American Stop Smoking Intervention Study, Project Assist. And under NCI and ACS, the American Cancer Society, woohoo, launched in South Carolina and 16 other states to implement what we call comprehensive tobacco control, but the focus was specifically on policy, media, and community programs. Y'all, that was back in the day when the money could be spent to go to retreats that we held at Kiowa and Seabrook Island, okay? Yeah, those days are over, okay, Barbara? But yeah, I distinctly remember those meetings. A lot of work was done. In 1990, the same year, is when the South Carolina a lot of fun was had too. I remember that. Yeah, oyster by the pool, anyway. In 1990, that's when the South Carolina Clean Indoor Air Act passed. It's got the same loopholes then as it does today, give or take a few. In 97, some of you know this, but I bet a lot of you don't. Before we even had the South Carolina Tobacco Collaborative, which became Smokefree SC, we had something called the Alliance for Smokefree South Carolina. I distinctly remember that. And at that time, in 97, the Alliance published a document called Saving Lives Through Public Policy, an environmental approach to tobacco prevention and control. And that focused on national and state policy issues that addressed tobacco use, but that's also when the first official model policies for workplace, schools, and healthcare facilities was kind of like published, okay? Then, as Sharon has mentioned, in 98, the famous tobacco master settlement agreement. Y'all need to know this. Yes, we took the money up front, but we were supposed to get $2.3 billion in South Carolina, and that's a lot of money. Today, it was a lot of money back in 98. But South Carolina chose to accept the money up front and took $900 million, and as Sharon indicated, that money is still earning a lot of interest in millions of dollars today, none of which is dedicated to tobacco prevention and cessation. So in 1999, the funding from the National Cancer Institute got switched over to the CDC, and that's when the CDC funded state cooperative agreements across the nation and U.S. territories. However, that following year is when South Carolina's tobacco control program was established. Sharon, she was already in the regions and health regions, and I was hired from another agency. And we both started along. Helen Deacle was still there, but she didn't come into the program until, did she stay? She left, didn't she? Okay. Because Helen's an old timer. She's been around as long as we have. So we got our CDC cooperative agreement, new staff were hired, and we were off and running in 2000. Sharon became our director shortly after that. And in 2001, the South Carolina Tobacco Collaborative was formed, and that became today's Smokefree SC. Woohoo, Barbara and Tara. These are both successors of the Alliance for Smokefree South Carolina. Now, what happened to the Alliance for Smokefree South Carolina that had almost 300 members, okay? That's a book I'm going to write, and Sharon may probably co-author it with me. That is another story that we will not talk about, okay? But In '04, we convened, some of y'all were there, we convened what we call the Statewide South Carolina Tobacco Policy Forum held at Hickory Knob. And we forged consensus and had conceptual clarity on key issues related to policy approaches for tobacco control. So we took that same document, Saving Lives Through Public Policy, refreshed it, re-upped it, and published a second one that became a resource action guide for the tobacco policy change in South Carolina. And those policies, those model policies, are still being shaped and used today. Obviously, we've added in vape-free campuses and all tobacco-free campuses. We've moved away from smoke-free policies to calling it tobacco-free and vape-free policies. So in 2006 is when we launched our South Carolina Tobacco Quitline with the 1-800-QUIT-NOW number, but I've still got some history to share on that in a second. That same year is when the town of Sullivan's Island enacted the state's first comprehensive smoke-free indoor workplace law. And Charleston came shortly after, and that's another long story that I will write with Dr. Jeffrey Wigand, the one who had a bullet in his, remember they did the movie about Jeffrey Wigand, you know, as a whistleblower, yeah. And he really did have a bullet in his mailbox. That is true. So Sharon's already mentioned 2010 was a game changer, y'all. The state excise tax increased from the lowest in the nation to 57 cents a pack. It increased 50 cents. Our smoking rate then was down to 21 to 22%, slightly higher than the national rate at 19.3%. But in 2012, lo and behold, the South Carolina General Assembly earmarked, as Sharon mentioned, $5 million. I know it sounds like we shared our slides, didn't we? As I promise you, mine get a little different after these. But anyway, they earmarked $5 million annually from the 2010 50-cent tax increase to DHEC for tobacco prevention and cessation programs, starting with fiscal year 2012. So that brings us a little history there. So I'm going to talk about our past with the Quitline. Now think flip phones and a BlackBerry. I know y'all don't even know what I'm talking about, okay? But I had a flip phone. In fact, I was one of the last people to have a flip phone. Never had a BlackBerry, could never work it. But anyway, happy birthday to the Quitline. I am a singer, but I can't carry a tune right now. But on August 18th, the Quitline will turn 20 years old. But before I brag too much, we were one of the last states to get a Quitline. I remember our partner at CDC, bless his heart, Rick Lancaster, who's since passed away. He was like, y'all have got to have a Quitline. So when we actually launched our Quitline, Sharon and I made a copy of the PO or the contract or whatever, and we framed it and we mailed it to him. We said, we got a Quitline. You know, California had already had a Quitline for a decade, okay? So, I mean, hey, other states, Meg, y'all know. Anyway, 20 years, y'all, that's an achievement. So let me tell you some background here. In 2002 and 03, yes, those were years that are still around, I attended two significant meetings. Sharon was with me at the CDC NCI meeting. But the first one was an Arizona gathering, and that's where I met Linda Bailey, who is the NAC founder and former CEO of the North American Quitline Consortium. That's where I learned about Quitlines for the first time, because when I was hired at DHEC, I'm like, what's a Quitline? And I remember Tom Gillette saying, we need a Quitline. I'm like, okay, what's a Quitline? That's how little I knew 20 years ago. I know a little bit more now. But we were one of the first states, original states that helped to launch the North American Quitline Consortium, and I have served 2 terms on their board of directors and helped write the grant that they have now, the counterpart to what Sharon has at NACDD. And then about that same time, I don't have the times correct, Sharon, just rough guess, at the CDC-NCI meeting, that's when we learned about the newly proposed 1-800-QUIT-NOW national portal, okay, offered nationwide. Now understand, states that already had their Quitlines going, they had a dedicated phone number and they were like up in arms. They weren't happy. They were like, no, you're going to put this number out there and we've got another number and that's going to be confusing. But for South Carolina, we're like, woohoo, that's going to be our number. So in 2004 or 5, before we adopted the 1-800-QUIT-NOW, we took advantage of NCI's toll-free line as a temporary Quitline substitute. I bet most of you don't even know this. Our first Quitline number was 877-44-QUIT, and we adopted this number for the Quitline, and it is still in operation today. I did search and Google and made sure yesterday or the day before that it's still NCI's smoking Quitline. But then we got some seed funding from the American Legacy Foundation, I will never forget that, to operate a skeleton version of our Quitline and to support implementation of 44U Quit. But it became apparent to Sharon and me that we had to just establish our Quitline. But the opportunity came with the CDC. And so in 2006, that's when we did launch with federal funding support. And I say that because now we're on state funding. So the 1-800-QUIT now is what we adopted as our official Quitline number, and we branded all of our materials. We received CDC supplemental funding. So that helped us, thanks to CDC's OSH, secured our first state-level procurement. I wrote that first proposal, and I'm like, if I could go back and redo, I didn't know what I was doing, y'all. I mean, it's just I stole from other states' proposals and just kind of put something together. Now I can do a proposal blindfolded. We started with $250,000. That's a lot of money to you and me. It is not a lot of money to run a statewide Quitline. But we started with $250,000. And then, as Sharon mentioned, our state tobacco prevention and cessation trust fund, that funding greatly allowed us to greatly expand and remove barriers with these funds earmarked from the cigarette tax increase from fiscal year 2012. So we were able to offer things we'd never been able to offer before. And we've been very blessed to have that money every year through the graces of the General Assembly. We do not want to tick anyone off. That's why I don't try to run a controversial Quitline. We try to keep stable, okay? I'm just being honest. So I got 3 slides on behind the scenes before we talk about the present day, okay? What most people don't know about the Quitline. Our budget started out at $250,000. We have gone as high as $35 million. Now, we've had to scale back some, I get that, okay? But even with a scale-back budget, we continue to have one of the nation's most successful Quitlines, thanks to continued state funding under the Tobacco Prevention and Cessation Trust Fund. Again, all of this is without the historic Master Settlement Agreement funding, which other states have benefited from. And we don't begrudge that at all. It's just that we don't have it. So I'm sure if somebody up in our agency saw this slide, they'd probably go, you can't put that in there, but I can because it's public knowledge. If the Quitline was federally funded, our Quitline now, we would have had to shut it down last April when federal funding and Sharon got furloughed and we had to cut back. We would have had to shut it down. And we've never, I mean, that's the worst case scenario. So I have to say, Beth and others, we have immense, Kelly and all that, even your predecessors, we have immense gratitude for our wonderful statewide nonprofit advocates that worked very hard, 10 years. But not only to the cigarette tax increase, y'all got to understand something. Other states marvel at this. They rallied and advocated for a portion of the interest, I may have that wrong, but don't hold me to it, for a portion of that cigarette tax funding to come to DHEC for prevention and cessation. And that was a game changer for our Quitline. So behind the scenes too, what most people don't know. Okay, y'all not gonna find this surprising. However, I went out there and saw it. So we had a lot of operational changes over the last 20 years. It started as a large call center, like the old Bell South call centers, that none of you even know what I'm talking about, I'm sure. But in downtown Seattle, had live coaches, like that slide on the left, working with participants in their counseling cubes or offices. We've gone all the way now to 100% remote staff, using a virtual platform with 24/7 access to live coaches and connections via online, digital, and mobile devices. We started out offering these live sessions between 8 o'clock in the morning and 8 o'clock at night on Eastern Time. Then we advanced and we were able to offer 24/7 access. We are closed on major holidays, the Quitline is, but we are open on New Year's Day to serve those making a resolution to quit, so I'm pretty proud of that. Behind the scenes 3, bang, bang, bang. I want to bang my head. We have been through so many business mergers and acquisitions. Any of you that manage a contract with corporations, they are forever merging and acquiring and doing this and that and the other. But it's all been interesting. It's been an interesting ride. Our business portfolio has involved all these mergers and acquisitions that cause a lot of contractual nightmares. So that's the kind of behind-the-scenes stuff that I have to deal with, our director has to deal with, but y'all don't even know about. And you're not supposed to know how the sausage is made. You're just supposed to enjoy it Even the vegan sausage is not pretty when it's made, okay? I just got that, okay? But we began in 2006 with Free and Clear. And the name changed then in 2011 to Allure Wellbeing, but the ownership remained the same. And then Allure Health, which was the parent company of Allure Wellbeing at that time, was acquired by Optum in 2015. And some of you know who Optum is. Optum is a subsidiary company of the behemoth United Healthcare. Then in 2022, which really, this one threw me now, okay? Because it wasn't a merger and acquisition, it was a joint venture. I had to go look up joint venture and educate myself because it's a little different business relationship. So we've got Red Ventures, which is a Fort Mill, South Carolina company, a multi-billion-dollar company, y'all, is up in Fort Mill in this state. It's a privately held company that owns a number of health brands like Health Grades and Healthline and so forth. And that's when RVO Health became our current Quitline vendor. So you can see how many changes we've gone through. And maybe for some businesses over 20 years, that's not a lot because they change businesses like they change their pants every day anyway. But at this juncture, I want to introduce those who are from RVO Health, our vendor. I want Logan Bernstein, Shivani Patel, and Lorenzo McCrae. Y'all wave your hand, show it. So they are our wonderful, they work for RVO Health, our vendor. They are our marvelous health systems change provider outreach specialists. And they live here in South Carolina. Oh, wait a minute. Shivani and Logan and Glenn cannot be here today. He's at a conference representing us. Lorenzo is our client services manager. So he was one of our specialists and then got promoted as our state's client services manager. The fact that Lorenzo lives here in the state is golden. And so do Logan and Shivani and Glenn. They live here in the states. They're boots on the ground. They are the ones that come and work with your healthcare systems all over the state, and they have done a marvelous job. So fast forward to the present. Think phone call coaching that's enhanced by digital and online support. So just some quick foundational facts because I don't want us, Sharon mentioned a lot of this, but I don't want us to forget that this is what our Quitline is based on. We know that all tobacco products, not just cigarettes, inflict devastating health, economic, and social cost. Billions of dollars. People smoke for many reasons, y'all. Peer influence, pressure, taste, stress relief, addiction. Quitting is very hard. It takes multiple times, multiple efforts, consistent intervention due to the nicotine's strong effect on the brain and behavioral dependency. It takes repeated clinical intervention and that's many times needed to help a smoker master quitting. So it's true, the more times someone tries to quit, the more quit attempts they make, the greater they are toward their goal of eventually quitting. But our Quitline is founded on this. Now, there's some sobering facts, y'all. Yeah, adult smoking is way down. Youth smoking is way down. Of course, vaping is way up in youth especially. But I double-checked this, y'all. And Dr. Everett Koop, who was our former Surgeon General back in the 90s, 80s, he's one of my former heroes. He had a famous quote that said, today, between 1,000 to 2,000 people will die from smoking. Their funerals will be held. No, I'm saying, I should have written it down, shouldn't I? Today, 1,000 to 2,000 people will quit smoking. Their funerals will be held in 3 to 4 days. That is a profound statement. Today, y'all, there's 1,300 daily deaths from smoking. So even though our rates are going down, don't let the noise tell you, oh, we've done our work. Like the last chart you showed, Sharon, the graphs showing how quickly we've done. People want to rest on our laurels and say we've done our work. No, we haven't. We have maybe fewer smokers, but those who are continuing to smoke are having serious chronic illnesses, serious behavioral health problems, and we need to continue to treat and serve these people. The costs are high, y'all. Cigarette smoking costs over $600 billion each year in direct medical care, 480,000 deaths, almost 500,000 deaths annually in the United States, and that includes secondhand smoke exposure. Smoking and smokeless damage near every organ of the body, cancer, heart disease, stroke, COPD, diabetes, and more. Cigarette smoking causes premature death, and the life expectancy for a smoker is estimated at 10 years shorter, y'all, a decade shorter than a non-smoker. And we do see this as a profile similar to our Quitline participants, that people who smoke tend to have less than a high school diploma. They're typically folks with lower incomes, and they are folks who experience mental illness, and they're the ones that are statistically more likely to smoke. So this is encouraging, y'all, before I get to some successful information about our Quitline. Deaths due to smoking are preventable. I want to say that again. Deaths due to smoking are preventable. And there are 70% of current smokers who still want to quit. So that number stands pretty steady. And over the past year, 50% have tried to quit. It's never too late to quit, y'all. No matter what age, quitting is still going to benefit a smoker's health. Our oldest Quitline participant, y'all, a couple of years back was 100 years old. Is that not amazing? I was floored when I read that in our evaluation report. We have the tools and resources to help people quit. Decades of science support behavioral counseling and medication as the gold standard for tobacco cessation. So if somebody wants to pass off a cessation program that doesn't include behavioral support and medication support, then that's not really the gold standard. Along with medical providers, we know that our public and behavioral health providers can also play a major role in successful smoking cessation when effective intervention is built into routine interactions with patients and clients. So we know what works. Let's use it to improve the health and well-being of all South Carolinians. People ask me, what can we do to help with the Quitline? What you can do is promote the Quitline. Tell them about the Quitline. I've got the link for our website, which gives you everything you need to know, thanks to our wonderful communications director, communications coordinator, Catherine Warner, and she's built our wonderful website. And I've got that link in the last of these slides. And Barbara, these slides will be posted for y'all, so y'all have access to them. Tab them. I don't use them. However. Anyway, so that and refer them to our health systems team. Contact me and I'll get you in touch with them. Let's use it to improve the health and well-being of all South Carolinians. So this is our Quitline. We're 20 years old this August. We have served over 250,000 South Carolinians since we started. We have over 100 unique healthcare systems and practices who routinely refer their patients to the Quitline. MUSC Martha and Diane are at least for now. They are at MUSC's one of the most successful inpatient cessation programs. MUSC is still one of our high referring providers to the Quitline, and we appreciate that. So they range from a few referrals a month to triple-digit referrals. Three Rivers Behavioral Health is one of our high referring providers, which I'm excited about. The Quitline specializes in providing free counseling, coaching, and quit medications to South Carolinians, mainly those who have no health insurance, but also to those who maybe have coverage, but they have fewer cessation benefits in their health plan. We also partner, as Sharon mentioned, with Medicaid, South Carolina Health and Human Services Healthy Connections, to provide counseling and quit support to their Medicaid members, and Medicaid reimburses us for the counseling that we pay for our for Medicaid beneficiaries. So we're proud of that if I can ever get that contract finalized. I want to poke my head again. I don't know. Y'all, the work is fun. It's the business stuff that drives you crazy, okay? Anyway, that's why I'm doing it, okay? I like a challenge. So multiple services are offered that are personalized and customized. So we really focus on pregnant, under age 18, those who experience one or more behavioral health conditions or have one or more chronic health conditions and are Native American. But I want to say there's lots of other high-risk groups that we have customized quit materials for them. You can access the Quitline 24 hours a day, 7 days a week. Our coaches are all trained tobacco treatment specialists. Our health systems change team are all tobacco treatment specialist, and Shivani will be, since she's brand new, I'm picking on you, Shivani, she'll be going through TTS training at Duke University very soon. I'm very proud of her. And the free medications offered are over-the-counter nicotine replacement therapies that are FDA approved for smoking cessation. So we dispense, and we dose and dispense, unless there are any contraindications, patch, gum, lozenge, or a combo of these. Nicotine replacement therapy is one of the most expensive costs for our Quitline. I will say that. But without it, we would not be successful. And our money and our budget has allowed us to do combo therapy, which is getting someone on the long-acting patch along with a short-acting gum or lozenge, a patch and lozenge or patch and gum. Enrolling in the Quitline, if you need to know how to do that, we have 3 ways to enroll. By phone at 1-800-QUIT-NOW, online at quitnow.net/South Carolina, or texting ready to 34191. So that's all on our website as well. We offer services and enrollment options in English and Spanish, but there are coaches that are trained in multiple languages that can help anyone who speaks any language. Logan, I stole this from you. Our services include, this is just easy to give a visual, one-on-one coaching, group sessions, text and web chat, an online dashboard where participants can track their progress, even track their nicotine, their NRT shipments, and then, of course, nicotine replacement therapy. You have to be 18 or older and not pregnant or breastfeeding to use nicotine. Now, we do know there are other Quitlines that do dispense to those under age 18, and they do dispense to women who are pregnant or postpartum, okay, or breastfeeding. We do not. We refer them back to their physician for that, okay? I'm not going through that legal hassle, okay? So who calls the Quitline? Who are our participants? This is our latest data, y'all. And this is rough, Rajiv. This is rough, okay? It's some general figures. Okay, y'all, with all the digital world that's being shoved at us, 76% of our participants enroll by phone. They still use the 1-800-QUIT-NOW. 80% say, I'm sorry, I've got that mint in my mouth. 80% say they're ready to quit. That is a good thing. They're at that stage of readiness to quit. 87% accept NRT. Of the products, 75% are tobacco only, and when I say tobacco, it's combustible smoking tobacco, like cigarettes or cigars. 10.6% are dual users, tobacco and e-cigarette users, and then about 11% are e-cig only users. 57% of folks enroll in our standard care program, which is just none of the customized programs, just our standard services, which is still pretty comprehensive. But we've got 38% that enroll in behavioral health. This is a customized program for those with co-occurring mental health and substance use conditions. And 2.6% pregnant postpartum. Now, that's a low number, but we lost our Baby and Me tobacco-free program, but our vendor is on it. Lorenzo told me stuff at our meeting yesterday that it shocks me. I'm surprised. So we're going to talk about some partnerships to try and ramp up reaching our pregnant and postpartum population. 30% hear about it from their Quitline. Yes, a lot of them hear about it from the TIPS campaign and ads, but 30% hear from a health professional, which we want to even increase that number. Who has insurance? 32.5% have Medicare, which y'all, what I've seen over the last 10 years is more and more folks who are eligible for Medicare are using the Quitline. Before, we had like single-digit numbers 10 to 12 years ago. We didn't have that many Medicare enrollees. Medicaid was pretty high, but Medicaid has pretty much stayed at the 20 to 30%. But Medicaid right now is 22%. 21% are uninsured, so there are more people with health insurance today, but then there are a lot of, y'all, let's not be mistaken, there are a lot of people still uninsured, okay? And then private, I had that wrong. Medicare is 20.5, Medicaid is 22. Y'all, I messed up here. 32. I'm sorry, I told y'all I'm still on brain fog. 32.5% are Medicare. 20.5 are Medicaid, 22% are uninsured, and 21% are private. And you're like, y'all serve people with private health insurance? No, it's 21% enroll and get services. And what we do, I'll make this very clear, if they have a health plan that offers them equal level or better coverage, we triage and refer them back to their health plan. However, if they want to stay with us, we're going to keep them. We're not turning them away. So in terms of insurance coverage, Sharon, I've never gone down that, Sharon probably wanted to pull me kicking and screaming, you need to be talking about insurance coverage, and I've never wanted to do it. And I'm like, we'll just serve everybody through the Quitline, and when we can't anymore, we just cut them off. Ooh, did I say that? Anyway, y'all, 74, almost 75% are age 45 or older. So it's obviously we're reaching the more mature set, okay? We're not reaching the younger numbers, and we're trying to ramp up our Live Vape Free program for our youth and young adults. But if smoking is down so much for youth and young adults, then one, they're not going to pick up a phone and call anybody, okay? My nephews are 35 and they don't call. They never call. They text, barely. But anyway, that's who we serve. 68.2% are white or Caucasian, 27.4% are black or African American. So that's 95% we're serving there. 58.3% have a high school degree or less, and that's a GED or no high school degree or high school. 59% have a chronic health condition, and these are in order of severity: COPD, diabetes, asthma, and cancer. Those are the top 4 conditions, medical conditions, that our participants say they have. They're smoking, and they have those conditions. 58.5%, y'all, and this number has grown from the 40% up to almost 60%. When they call the Quitline, they are asked at intake, do you have any kind of behavioral health, mental health, alcohol and drug, or other condition that you think might be a barrier to you quitting? And if they say yes, then they inquire more. I hope they do with Lorenzo. Inquire more about, what specifically, tell us more about that and everything. And so we're looking at mental health, illicit drugs, alcohol, and those are the main things and everything. So I have to say that we were doing this, South Carolina was doing our behavioral health partnerships before it was cool, even before CDC made it a statewide requirement. And I want to recognize Maria Trammell in the very back with her hand raised up. She is with the former Department of Mental Health, which is now the Office of Mental Health, along with the former Department of Alcohol and Other Drug Abuse Services, which is now the Office of Substance Use Services, that are now under the brand new Department of Behavioral Health and Developmental Disabilities, that are all together with us at DPH at Otari Parkway, 3 miles from my house, let me say. So I'm happy about being in Casey, okay? Because I live there. But Maria's one of our wonderful partners, and we partner with them, and we meet on a regular basis, and wonderful partnership, because this is an untapped area where we still have lots of work to do. And alcohol and drugs and mental health share same clients, same patients. We see that they are more likely to, in their treatment, let me rephrase this, y'all. In their treatment, and I'm speaking for the alcohol and drug folks, in their treatment plan, they are more likely to give up crack cocaine, heroin, alcohol even, but they don't want to let go of smoking, and we're trying to help both the professionals and the patients and clients themselves see, okay, while you're still, doping your brain with nicotine, you're interfering with treatment. This is going to interfere with recovery. And so it's just like with our Can Quit program that we had to close down a little bit, but with cancer patients, it's a game changer. Yes, they know smoking causes cancer, but it's a game changer when they learn that, did you know that your continued smoking or tobacco use can interfere with your treatment? Why in the world would someone go through the painful, excruciating chemotherapy and radiation, grueling treatment regimen, and it not work because they're still smoking? So we've got to expand and fine-tune our messaging with cessation and help people find those reasons to quit. Okay. Our snapshot of successes. Now, I'm looking at then and now. So when we go back to our year 1 in 2006, I was so excited. And it's just August to December. I was so excited. We had 872 calls to the Quitline. I'm like, whoa! But then if you fast forward to, and I just went to 2025 with our data, okay? But in year 19, 2025, last year, we had almost 14,000 calls to the Quitline. Now, again, enrollments, contacts, let me use the right words, access and contacts. But look, y'all, of that 13,726,000, 11,582 were from the 1-800-QUIT-NOW for the direct calls. 2,144 calls were web visits, okay, on our web. And then the text is just, there's not enough texting to even track. Provider referrals. Our first year, we couldn't offer a provider referral program until 2008. Until 2 years later is when we offered that. And I was so happy when we had 39 referrals from doctors and nurses and all that. Now we've got like well over 8,000 referrals by these providers. The number of NRT products in the first year, which we could only, y'all, we didn't start out offering NRT. We couldn't afford it. But we could, starting in 2009. We started a short, small, limited edition of limited shipments of the patch gum and lozenge. No combo, because that's expensive. But we had 80 shipments, and now today we have 8,658 shipments going out. Our quit rate, pay attention. In our first year of evaluation in 2007, South Carolina had a 19.4% quit rate. That is, industry standard is measuring, have you quit, and not even one puff for the past 30 days, and it's measured at 7 months after they enroll. So it's not like you're going through 4 weeks of a program and you ask if you're quit on the 3rd week or 4th week or 5th week. No, this is 7 months, and if they're not smoking. So 19.4% was our quit rate. Today, y'all, our latest evaluation, because we're currently in our 2025 evaluation period. We don't have those data. Year 16 eval, y'all, our quit rate is 43%. And we're one of the highest in the nation. We have fought hard to get there. But look at this, y'all. For our behavioral health participants, it's tough for them to quit, y'all. They're fighting demons. Our quit rate is 31% for those, okay? Now, I will say that, our quit rate can drop and it can fluctuate, but we've maintained that quit rate now for a few years. Participant satisfaction has been pretty stable. 97.3% in the early years, 97% for our standard. And look at our behavioral health folks. They're actually more satisfied with the program. So as long as they're happy, I'm happy, okay? So interesting to note before I get to the future, and I'll wrap up with the future and Q&A. How does that work? Okay? All right. NACS, North American Quitlines Consortium, who is our industry, leader, their benchmark for state quitline quit rates is 30%. So our quit rates in South Carolina have remained a consistent high between 40 and 43% over the past 5 years. I just want to say, Sharon indicated, I keep referring to you because you did such a great job before me, but Sharon and I both know this has been hard fought. This has been hard work. I've lost 50 pounds since a year ago. Yeah, I was big. I've lost 50 pounds. Let me tell you, it has been pure hard work, okay? So if you want a good outcome, be ready to put in the work. That's your mama speaking, okay? Go clean up your room. Okay. We even do well with our ends users, those who measure their quit rates for users of electronic nicotine devices, whatever they're called. They've got 5,000 names, okay? But 37.7% is pretty good, y'all. So until we offered, yes, we launched in 2020. During the pandemic, I launched a statewide procurement contract during the pandemic, all virtual. If you can do that, you can do anything. We launched our tobacco e-referral hub, and we have a separate contractor from our Quitline vendor, who operates our hub, but they work very closely together. And we try to convert providers from fax referring to using their electronic health records, their EHRs. So as of March 26, our referrals from providers are now at 38% fax, 60.5% EHR. Y'all, that's pretty good. And 1.5% online. So for offering even providers that online access, they're still going to do it from their EHR. So we've still got a lot of work to do, but we are slowly succeeding in converting from fax to e-referral. Then I just want to say before I move on, while the push is on to convert more services to digital platform, in fact, our vendor is pushing us fast in that direction. But the data show that out of our recent interactions with the Quitline, out of 6,596 participants who have interacted with the Quitline, 53.5% utilize our digital tools, and there are a lot of wonderful digital tools that they can access, like the dashboard and a chat with a coach. But 84.4% interacted live with a coach. So, Lorenzo, take notes. there is still value in that live interaction, that personal interaction to help people and help support them in their quit journey. Trend data over the past year has shown that between 85 to 90% of our participants prefer to speak with a live coach, and phoning the Quitline is still the preferred method. So the quit now is not going away. Coaches aren't going away. They may look a little different, but they're not going away. So what's our future? Okay, Lorenzo, if I mess up anything, just let me know, okay? But I'm thinking, think mobile apps, think AI, God knows AI, support, and maybe even telecounseling one day. So, on the horizon, y'all, if we can harness the good of artificial intelligence and securely protect ourselves from what we know is the bad, then we're going to see more of an AI presence in our enhanced Quitline services, quit services across our state. There is a shift in products. Now, it's different. Yes, there's a shift in products culturally. We know that. But our Quitline is going to start embracing users of oral nicotine pouches like Zen, Velo, On. It's not. It can't just be On. It's got to be On. Anyway, and other ever-emerging nicotine products. Because while we've been in this room, the industry has already created 10 new products, okay? And they got them in the pipeline. Anyway, to better serve along with combustible tobacco and vape users. So we're going to see that coming slowly but surely. Something that Lorenzo and RVO has introduced me to is a program they're going to launch called HOPE. These are AI agents, okay, that will be added to help give a more adaptive support and quick answers with tons of guardrails put in place. I have made that very clear. If the guardrails aren't there, we're not doing it. It's like an interactive text messaging service, and that'll help free up live coaches so they can concentrate on delivering direct counseling support. And that's currently in the developmental pipeline. I'll give you an example. Say an enrolled participant has a question they want to ask their coach about, okay, I'm using the patch, but should I take it off at night before I go to sleep? That's a quick answer. Yes, you should, because you could have some dreams, and yes, it's better if you take it off at night. That's a quick answer that an AI agent could answer, and we can free up a live coach to actually do that in-depth counseling. So that's as good as it gets on that. Okay. Y'all know, some of you already know this, but the Quit for Life, if you're a state employee, then if you're under the state health plan, our smoking cessation benefit is the Quit for Life program. Same program as our Quitline, only it's commercially promoted, okay, and marketed. So our vendor is wanting to move us more toward Quit for Life, and there'll be an app coming out. So we'll see some changing on the website a little bit. Same program, just a different look. But apps are nothing new. Y'all know that. Y'all use apps more than I do. But it's geared for users who prefer services on their smartphone or smartwatches. You know, it's not the watch that's the vaping device. Y'all do know vaping devices are in watches now. Yeah. Okay, yeah. I don't even have a smartwatch. Why do I need a vaping device on my wrist? Anyway. It's crazy, y'all. But this is already approved and in production line for release in the fall, and this will be an app that can be downloaded on Apple, Google, Samsung, or Android devices. So our Live Vape Free program, you're not going to hear me say a lot about that, but just know that we have a dedicated program for youth ages 13 to 17 and young adults ages 18 to 26, which is all digital platform, and we serve these youth who are vaping, and we are seeing some uptick. We have done some recent promotions, and we're seeing the results of those promotions. So this is a slow crawl to get our youth, but we really need, our team is going to work more with schools are chomping at the bit to know more about vaping. Smokefree does an excellent vape talk. They've been doing this for several years. They do excellent vaping support. Our prevention consultant at work, LaQuana Jackson, does great work and everything. But this is getting kids into treatment, okay? It's not just education. It's not educating parents and giving them tools. This is treatment. So Live Vape Free does that. But we're just going to see some background quality improvements that are being considered to just enhance the platform experience for these younger participants, constantly having to keep them engaged, okay? Then something called omniboarding that I may or may not get this right, Lorenzo, but it's just, again, just another background upgrade that's going to help to improve the enrollment flow to make it easier. Y'all, there's all kinds of little things, just like if they're warm transferred or they're referred. Now, see, they're warm transferred on their telephone, like IVR. Would you like to talk with someone at the Quitline? And the person says, yes, press 6 if you want to talk with someone at the Quitline. So the person's on the phone, they've already said, I want to quit, and they want to talk to somebody. But y'all know that when, it's like these scam robocalls, you know, it's not until you say hello or say something, and then there's a second pause, and then a live person comes on who doesn't speak your language. Okay, anyway. But with this, seconds matter. And 3 to 4 second or 6 second delay can be a game changer if we can reduce and improve that flow where they're immediately connected to a live person so that the person doesn't just hang up. And so tiny little things like that can be game changers in the flow. So improving how we process intake and registration, and obviously to get more participants on board with evaluation. Just like every evaluation, we are low on people, wanting to take a survey and be involved anyway. So we are rolling out pregnancy and postpartum incentives, but we're not really sure how that's going to look right now. But through one avenue, we got 2 options, Baby and Me through our vendor, going back to that platform, or with just our own incentive program if we can budget it properly. Because as Sharon said, we're on federal funds right now. Come April next year, we may have to all be on state funds, which is, again, a painful, excruciating budget changes for us. But we want to offer voucher incentives. We want to, for those who are pregnant, have recently delivered a baby, diapers and baby wipes a year post-delivery, stay engaged. We've not yet figured out how to validate. Baby and Me program knows how to do that well, but we've not figured out if we do it from our end. But we're working on it, okay? Then, this is my wish list. Doggone it, y'all, it's time for us to do telehealth. Okay? And Baby and Me is offering telehealth, but we need to do it with the Quitline. Lorenzo, we need to do it with Quitline. I call it, telehealth has many names. Telemental health, telepsychiatry, telemedicine, telehealth. You know, there's 1,000 names for telehealth. I call it tele-quit support, offering a counseling platform that mirrors telehealth appointments where eligible providers can deliver real-time and live counseling quit support to their patients and participants that's backed up by the Quitline's tools and NRT. And there's a great potential for licensed medical and behavioral health providers to bill and reimburse for these telehealth services. We just have to have the will and the budget and the infrastructure to do it. Medication expansion. Continuing to offer NRT patch gum and lozenge, but expanding our formulary. This is my dream, to expand our formulary to dose for varenicline, and hopefully, if the FDA will approve it, don't hold your breath, cytisinicline. How many of you have heard of cytisinicline? Good. Some of you haven't. Okay. It's been on the market in Europe for ages, okay, for a while, with doctors authorized RX, okay? But for us to build those into our Quitline would be game changers. Cytisinicline, for those of you who need to know, and if you're medical, don't hold me to this, it's an investigational plant-based alkaloid, and it acts like a partial agonist in the brain, at the brain's nicotinic receptors, okay? A lot like varenicline does. It helps individuals quit smoking and vaping by reducing nicotine cravings, withdrawal symptoms, and the rewarding effects of nicotine. It works like varenicline, like I said, but y'all, studies have validated it as more successful with fewer side effects. So while varenicline can make a success 30 to 50% more successful if a smoker gets on varenicline than if they just use nicotine pouch, a gum, lozenge, or a combo, or the other FDA-approved medications. Well, varenicline is approved, okay? And Medicaid patients don't have to pay for it. Remember, Medicaid beneficiaries, Medicaid members don't have to pay for any of these medications because our agency in South Carolina offers them free with no copay and no prior authorization. But come alongside cytisinicline, and not only is it as or more effective as varenicline, it has fewer side effects. So that's a big deal. Cannabis users, God bless them. I'm not going to look at you if you're one of them. Hopefully, we will reach the time when we can offer services and promote the Quitline to marijuana users. Same issues, different addictive drug. Same issues, different addictive drug. Because this problem is only going to grow stronger, and I'm only speaking for our state. Y'all, I'm not speaking y'all states, okay? It's only going to get stronger and get more out of hand from both policy and health perspectives, much like vaping has done. So my disclaimer is these previous slides are my wish list and are not necessarily in our vendors or anyone's pipeline. I'm just forecasting 3 unique features that, if added to our Quitline services, could be game changers for how well we succeed in nicotine cessation across our state. So if you need to get in touch with me, here's my email. Y'all, I actually put in my personal email. That's how out of it I have been. But I had to go back and put my DPH email and my phone number, only nobody uses the phone anymore. I'm surprised when somebody actually calls me. And then our Quitline, just go to quitnowsc.org and you'll find everything you want to know about the Quitline. If you don't, then just call me. Here's some references, just a few, just to say that I did do some research, okay?